Thank you, everybody, for joining us for our first webinar in the training series by experts. And it's an honor for us to have Dr. Lee Kirby here with us. And a quick introduction about him. So he's received his MD degree from Dalhousie University in Canada. He is a professor in the Division of Physical Medicine and Rehabilitation in the Department of Medicine at Dalhousie University. His primary research interest is the safety and performance of wheelchairs. He has held research grants from several national and international funding bodies. He has authored or co-authored 2 books and 170 papers in peer-reviewed journals. He heads the team that developed the Wheelchair Skills Program, a low-tech, high-impact training program that is relevant for both more and less resource settings. It's an honor for us at ISWP to welcome Dr. Lee Kirby for this first kickoff webinar. And over to you, Dr. Kirby.
Thank you, Krithika. Can you hear me all right?
Yes, we can hear you.
Yes, it's always humbling to be called an expert, but an expert is defined as someone from another country who has slides, and I'm probably from another country for most of you, and I have some slides we're going to go through this morning, so I guess I qualify under that category. As you can see, my topic is the assessment and training of wheelchair skills, and we're going to be talking a bit about the research evidence, but mostly about translation of that into clinical practice. I have no conflicts of interest to disclose. I'd like to acknowledge the other members of our wheelchair skills program team. There's a large number of people from diverse backgrounds who I'm very indebted to, and I'm very appreciative of the International Society of Wheelchair Professionals for giving me this opportunity to share our work with you, and particularly to Krithika, who's set up everything for us. The target audience in preparing this presentation is for wheelchair service providers and for researchers, and hopefully overlap between the two. As far as available materials go, a PDF file of the PowerPoint presentation has been sent to Krithika, and I've encouraged her to share that with anyone who would like it. Also, this meeting, as Krithika mentioned, is being recorded and will be on the ISWP and the Wheelchair Skills Program YouTube channels. Also, our website is listed at the bottom there, and there are a lot of materials there that you can access. Objectives for this session are listed here. I'm sure most of you already recognize the benefits and problems of wheelchair use, but it's part of the introduction. We'll review the steps in the wheelchair service delivery process. We'll tell you about a free online resource regarding wheelchair skills and take you through how to use the website in the slides. We'll discuss briefly the extent of the supporting research evidence regarding assessment and training, and hopefully by the end you'll have a sense of how you might implement these protocols in your own settings if you haven't already done so. Just as a general setting of the stage, as you know, in rehabilitation, one of the most critical things we do is provide appropriate assistive technology to people. And I think this quote really encapsulates the benefits that provides. Within assistive technology, I would argue that the wheelchair is the single most important, does the greatest good for the greatest number of people, at least those with severe mobility restrictions. But I guess I'm preaching to the choir here, or you wouldn't be attending this webinar. As far as the benefits of wheelchairs, they're shown on the left here. Broadly speaking, mobility, improved ability to get from one place to another, a reduction of caregiver burden, reduced likelihood of placement in a long-term care facility, and improved participation in people's roles in society. However, wheelchairs are not without their problems, and these include improper fit, frequent need for repair, overuse injuries if you've been using the wheelchair for many years and many hours a day, and acute injuries due to tip-over accidents most frequently. In order to tip the balance to improve the benefits and reduce the problems, there are 3 broad areas, in my opinion. The first is better accessibility in the world. The second is better wheelchair design. And the third is better wheelchair service delivery. In today's session, we're going to be focusing on the third, the better wheelchair service delivery. In 2008, the World Health Organization published its guidelines on the provision of manual wheelchairs in less resource settings. This has proven to be useful in all settings, not just less resource settings, and it's really revolutionized how we think about providing wheelchairs. They've gone on to produce a number of subsequent training packages shown here, and these are all freely available on the World Health Organization website. The wheelchair service delivery model of WHO has 8 steps. They're listed here, and I'll let you read them yourself more quickly than I can do so. And none of them would be any surprise to people involved in this field. There are 2 that are particularly relevant for today's presentation, and that's the assessment and the user training. Those 2 are dealt with within the Wheelchair Skills Program, which was established in 1996. So this is our 25th year with the Wheelchair Skills Program, and it continues to evolve. And we're very pleased by that evolution. The 2 components that we're talking about today, the assessment, the wheelchair skills test and its questionnaire version, and for training, the wheelchair skills training program. Yeah, these are covered. If you go to our website, which looks something like this on the opening page, and you click on skills manual and forms, you'll come to a page like this. If you click at the top here, the wheelchair skill program manual, just the most recent version of this was put up in August of 2021, version 5.2. And you can get a bit of a sense of the types of people who've been involved in helping us put this together. It's 333 pages long, so it's primarily a reference manual rather than something that's useful for everyday use. If you go back to that previous page on the website and drop down a bullet to the caregiver handbook, this particular handbook was created for a research project that we're doing. And it's written for caregivers to read it themselves. So the language is set at a more simple level, and there's an accompanying video that goes with it. This is only 55 pages, and it just focuses on caregivers. We're hopeful that we'll have additional well-focused versions of the manual in the years to come, looking at different patient populations, such as people with spinal cord injury or stroke. And there's a group within our editorial committee working on a pediatric version. So if we turn our attention to the assessment, the wheelchair skills test, I'll take you through that first. And I should say that we're focusing here today on manual wheelchairs as used by wheelchair users. There are also aspects of the manual and the forms that deal with caregiver assessment and training, powered wheelchairs for assessment and training for wheelchair users or caregivers, and for scooter users, and just primarily the scooter user themselves, because most scooter users don't use caregivers to help perform with their scooters. So if we go back to the website and look on the same page that had the manual on it, we drop down to the various forms, and we'll just have a look at the wheelchair skills test form, version 5.2. The full form doesn't show on this page, but it's a front page that shows 32 separate skills ranging from very simple ones like rolling forward, rolling backward, turning in place. Down at the bottom, you'll see a little later, we get all the way up to going up and down stairs. So for each of the skills on the form, there's room to score the skill on the basis of capacity, and we'll come to the scoring criteria in just a minute, and to write down any comments. If you turn to the back side of that page, there's the scoring criteria. As you can see, they range from 0 to 3, from a fail to an advanced pass. The advanced pass means that you're highly proficient, obviously. A pass means that you carry out the skill independently and safely, but there's room for improvement and something that the trainer can work on. The comment section are also very important, and the comment may reflect on someone's diagnosis. And this is the first video, and always a little nervous to see whether the videos will show when we click on them, but here we go. This gentleman was admitted with a left above knee amputation. A prosthesis was prescribed, and we eventually got around to looking at him propelling his chair. And as you can see here, within about 5 seconds, you realize that this man has Parkinsonism, which we didn't realize before that time. We immediately canceled his artificial limb, got him in a power chair, got him on Parkinson medications, all from just taking the time to watch him how he moved his chair. The comments can also reflect on items that are going to be important for training. So in this young lady, as you'll see here, attempting to get over the gravel. She's making a fairly typical mistake of leaning forward to try and put more force on the wheels. And in so doing, she's putting more weight on her casters, which tend to dig into the soft surface. So for her, the comment would just be about her leaning forward, and the trainer would come back and deal with that by having her to get her casters up out of the gravel or a soft surface. So if we go back to the pictures and videos section of the website and click on that, you'll come to quite a number of videos there. And we're going to have a look right now at this first one. It's a full manual wheelchair skills test with a therapist simulating paraplegia. We'll just talk our way through that. The therapist is Amira Tawashi. She's an occupational therapist and both practices and teaches in this area and does a lot of international work. The tester and trainer is Cher Smith, also a very talented occupational therapist. The first skill is rolling forward. It's 10 meters on a smooth level surface and coming to a stop without touching an obstacle at the end, in this case, the wall. Second skill is only half that distance because you usually don't have to go as far backwards as forward. It's 5 meters, but again, the instructions are simple. And Cher is using a spotter strap here for safety. Amira is doing a good job of doing shoulder checks to both sides to see where she's going, that she's remaining straight. And as you can see from the mirror, she gets within 10 centimeters of the wall. Turning in place, we've changed the skill around a little bit for the latest version. We just use these two green lines and center the chair over the lines, and the person is asked to turn around 180 degrees and face the opposite direction. She has moved a little bit to one side, so she gets recentered and then is asked to come back in the opposite direction. Amir does it. It's sort of a snap turn there, with just a single stroke in either direction. Turns while moving forward. Again, we've modified this a little bit for the version 5.2. And so Cher is setting Amira up in the middle between two cones. They're just empty beer mugs, 2 meters apart. And the instruction are to go around each of the cone and sit in a figure 8 as close to the cone as possible. And the scoring relates to how close you get to the cones and not disturbing them. The same test is done in the backward direction.
This time, can you go around the cones again?
And everything so far, Amira would get a score of 3, which is an advanced pass, but going backwards is a little more tentative, takes them a little more widely, has to correct her position. So this would be only a 2. There's room for improvement, and it would be something the trainer could spend some time working on. Sixth skill is maneuvering sideways. So we're setting a person up at a distance of 1.5 meters away from a couple of blue plastic containers. They're very useful to have in your testing area. And the mirror uses 1, 2, 3, and 4 steps to get there. And she doesn't go beyond 1.5 meters forward from the wall, which is where she started. Going back in the opposite direction to where she started. 1, 2, 3, okay, 3 and a bit. And she has to get within 10 centimeters of the target to get a full score. As far as reaching objects, you're picking up an object about the size of a cell phone off the floor is one part of this. The person is allowed to maneuver the chair in any way they wish. She gets her casters trailing forward, which is good technique. If you're leaning forward, to avoid tipping over in the forward direction. The second test is reaching upward to a mark on the wall 1.5 meters above the floor. She moves well and uses a little reinforcement there to make it a little bit of fun. Skill number 8 is new to the manual wheelchair skill set, and it has to do with seat elevation, the leg rest elevation, tilt, recline, and so forth. She doesn't have those options, so we just move on. That's a not possible score, so it isn't counted against her or for her. This is shifting weight. She's just asked to get the weight off her buttocks. She does so by side leaning, and by asking permission, the tester can go in and check that there's been good pressure relief. You have to maintain this position for 15 seconds, and then the same in the opposite direction. We discourage push-ups. That you could get a pass for doing push-ups, but you would only get a 2 rather than a 3. It would not be considered an advanced pass because of the loads on the wrists and shoulders and the difficulty of maintaining it for a significant length of time. Level transfers are skill number 10, set up facing the object. We can provide the transfer board if they need it, because people tend to leave those at their bedside or in their car, so we don't expect people to haul them to the testing site with them. Mira does a good job of getting herself forward on the seat. She doesn't lock her brakes, but she does a head versus hips transfer. Because the floor is a little uneven, she locks the brakes afterwards. She doesn't lose any points for this because the chair didn't roll away and coming back. So it's in both directions. While she was out of the chair, we would also check the next skill, which is the folding and unfolding of the wheelchair before getting her back in. But for presentation purposes, we put the 2 transfers together. She gets the cushion off. She folds the backrest down. The push handles here fold, so she gets those down.
Wheels off? Please.
Now you'll notice she takes the right wheel off and she puts the axle down on the cushion, which is not a good idea, and the other axle down on the bench. So those are the greasy ends. We would recommend that they be facing up. And now she puts the right wheel on the left side instead of the other way around. Now this doesn't really matter for this particular chair because the tires are not bidirectional, or they are bidirectional, they're not directional. But for a wheelchair that had tires that were directional, that would be a problem. So we encourage people to get their wheels back on the same side that they took them off from. And many people are not too careful about putting their cushion back in the correct position, but Amira did. So she would get a 2 on that, not a 3.
Can you show me how you're able to get
The ground transfer is the next in the list of skills.
Oh, my brakes are on
She already has her wheel locks on. Any technique will do. But we don't want people to sort of drop to the floor. We want them to be a transfer. This is very similar to the sideways transfer, the way Amira is doing it. We encourage in training people to get their cushions off and to sit on them. It has the effect of both lowering the seat height, but also raising the floor height, so that you've made it a lot easier to get back onto the chair. Amira is doing her best to get the casters oriented in the forward direction, but they seem to be resisting her a little bit in this. So it's just a bit, a few too many steps there, and the chair does move away a tad. So we would probably give her a 2 rather than a 3 on this. He does get out and get back in, but there's some room for improvement, so that the trainer would spend some time on that. You don't have to get the cushion back under you because we've already assessed getting off the chair and level transfer and putting the cushion back in. Getting through the door for testing purposes, we use a door that doesn't resist opening. Set the person up in front of the door. It's up to them to maneuver out of the way. They need to go through the door and close it behind them, both door opening towards them and coming back in the opposite direction.
Can you open the door and go through it and close it behind you? All right.
Good technique. She would get a 3 on this. We have both slight inclines, which is to code to 5 degrees, and this more steep one, 10 degrees. And so that would be a 3. She leans forward nicely, no transient tips. And then coming down the slight incline, she's expected to stop before reaching an obstacle at the bottom. In previous versions of the with WST, we asked people to stop part way, but we've removed that from the test for this version. She has her hands in a sort of 1 to 2 o'clock position and slowing her descent by friction nicely. Similarly for the 10-degree incline.
This ramp. Now we're ready.
So lean a little farther forward to keep the casters on the surface.
So you're gonna wheel the chair down the ramp.
Notice that in addition to holding onto the spotter strap, Cher has her hand in front of the shoulder in case at a sudden stop or a pitch forward that she'd be able to prevent Amira from falling from the chair. The side slope is 5 degrees and have to do it with both the left and right wheels in the downhill direction. And we set the person up on the slope in a way that we can tell whether or not they've drifted downhill by more than 10 centimeters. If they have, they wouldn't, that would be a fail. So the instruction is just really to wheel across the line at the other end. And she does so. Our side slope is a little on the small side, so we tend to help people around into the new position before checking them in the other direction. There's usually not much difference for someone with paraplegia going left and right, but for someone with hemiplegia, there's quite a difference depending on which foot is uphill. Rolling on soft surface, it's only 2.5 meters in duration. Here we showed the gravel surface earlier. We tend to use the gym mats most often. Amira does a nice job of getting her casters up out of the surface, so she moves forward nicely in that way. And as soon as the casters are over the 2.5 meter mark, the skill is completed. We use a longer section, 5 meters, for training purposes. The next skill is getting over an obstacle. This is 2.5 centimeters high. You're allowed to use a moving start. You has to pop the casters and you get over it. She pops nicely, approaches nicely, but it didn't lean to get the rear wheels over. So it's a minor comment, and the same thing here with getting over a gap, that she doesn't do a trunk lean. So she got a 3 on that because she didn't really need the trunk lean, but it would be something we'd want to address. You'll see the trunk lean becomes more important as we get to the popping skill of getting up a low curb here. And again, a higher curb in a minute. Descending the low curb, which is 5 centimeters in height. The simple roll off can be done safely. And if a long wheelbase, even higher, can be done, just has to lean back. But we don't usually get away with that for coming down higher curbs, as you'll see in a minute. Getting up the high curb, she wants to start a little farther away, and so it's permitted. So you can really see the importance of the trunk lean there. Descending the high curb, she can do this. You're not allowed to do it in the forward direction with a chair with a short wheelbase like this, but she's permitted to turn around and do it backwards. You'll notice as she does it, that she keeps the wheelchair moving after the rear wheels land. If she stopped quickly, she would tend to tip over backwards. The stationary wheelie, we asked someone to do that over the cross on the floor to be able to check how much forward and back movement they have. We asked them to do it for 30 seconds to demonstrate their skill. We're going to shorten that for this video just for training purposes, but she does the 30 seconds and then lands successfully when asked to.
You can come down.
Now that we've got the wheelie, we can do a few of the wheelie related skills, such as returning to the turn in place skill.
Okay, so can you please get the chair into a wheelie and turn around to face that wall, and then you can come back the other direction. I'll just use a spotter strap. Okay.
It's not necessary for her to come down out of the wheelie between turns to the left and right, but it's permitted to do so. And she's taking short little steps in coming around here rather than the large snap turn that she showed for the turn in place with all 4 wheels on the surface. But she manages to stay reasonably centered, and she ends up pretty much where she started. We also expect people to be able to roll forward and backward in the wheelie position. This is important if they're going to be using the wheelie to come down a curb or an incline, because you have to be in control moving forward to the edge for those 2 obstacles. So you need to get into the wheelie and then to move forward a couple of meters, excuse me. She does that nicely, dipping forward and then rolling to catch up with it, and coming back. As with most people, it's a little more scary and tends to be a little more tentative. There's some reactive balance corrections there. Coming down the high curve in the wheelie
Can
position.
you show me how you come down the curve in a wheel?
We expect the rear wheels to land before the casters do.
Spot on.
For the spotting here is we use our hands near the push handles if there are any, rather than using a spotter strap, because if one wheel drops off before the other, it's pretty hard with a spotter strap to prevent a sideways tip. A second spotter can be quite helpful in this circumstance.
Okay.
This is coming down the steep incline in the wheelie position. She mirrored that successfully, but she sort of lands somewhat abruptly. That needs a little bit of work, so probably a level 2. Going up the stairs can be done in different ways. We recommend that people get out of if they can't find a ramp or an escalator or an elevator, we recommend that they get out of the chair and go up on their buttocks, taking the chair with them. The mirror gets on the first step. We would generally recommend that if you're transferring to the stairs, if you're able to get up on the second step to save yourself a little bit of work there. Gets herself positioned, it gets the chair positioned, a little tentative at which stair to put it on, but eventually gets it where it ought to be. Really should have her hands on the step above, and then she brings the chair up. So there's a little bit of work to be done here. She gets up all the way. She does not have to get back in the chair because we've already assessed her ability to get from the floor to the seat. So for ascending stairs, she would get a 2. She gets there, but there's some room for improvement. Coming down, you can come down on your buttocks, but if you're in your chair and you have a stair rail to use, then the backward technique is fairly easy and not hard on the shoulders. Going up the stairs in the chair is quite hard on the shoulders and arms. You can grab onto either rail or both of them coming down. Again, the spotting here is with the hands near the push handles rather than using the spotter strap to protect against the sideways tip. There we go. So that's one complete wheelchair skills test. The only skill we didn't show was the changing the body positions. If you go to the opening page on our website, you can see a link here to our YouTube channel. And if you go to the YouTube channel, that video that I just showed you there is shown in full, 16 minutes. And so you can see it at any time you like there. And the report form for that particular skill is on our website. So you see how we scored it and what comments we had for that. Now, if you go back to the forms page and we drop down to the wheelchair skills test questionnaire, you can see it looks very much like the wheelchair skills test, but now it's a questionnaire. The same list of 32 skills, but now instead of just looking at capacity, we look at can they do it, which is performance, because you're asking about it in their own setting rather than in an artificial setting, a test setting. But you can also ask questions about their confidence and how often they do it. So on page 2, you can see the scoring for that. The performance is very much like the capacity scoring for the wheelchair skills test, whether you do it really well or whether you can do it but not that well. And your confidence ranging from very unconfident to very confident. And how often do you do this skill in your own setting? Always when I need or want to, down to never or less often than once a year. In addition to having a form like that, we also have this set up as a script that's available so that you can pass this to someone and ask them to fill it out on their own. In it, for both the wheelchair skills test and the skills test questionnaire, in addition to the scores for the individual skills, you can calculate total scores as shown here. basically take the total scores that they achieved, divide it by the total that would be possible, removing any skills that for which it would be not possible to test for, and put down with the questionnaire, you can do the totals in the same way. So that's all well and good. That's what the assessment is in the wheelchair skills program. But what's the evidence that this is reasonable? If you go to the web page again and go down to the section called Publications and Impact, and you click on that, you'll come to some PubMed searches that we have set up by our health sciences librarian. So if you click on this, it'll immediately do an immediate search for you and come up with the number of articles. And as of yesterday, there were 100 papers that were either about the wheelchair skills test or questionnaire, or that had used them as an outcome measure for other study. Just as an example of the type of paper that you'll find in there, this is one we published fairly recently about the measurement properties, which is to say the reliability and validity and so forth of the wheelchair skills test for scooter users. So it's just an example. So now we'll move on to training. And I should have said when opening here that if you have questions, I encourage you to put them into the chat window. I won't deal with them until the end, and I'll ask Krithika to perhaps post them for me if I can't bring them up and look at them myself. But if you think of questions as we're going along, feel free to please pop them in there right away, but I won't deal with them until later. So the wheelchair skills training program consists of two components, the process, which is to say how to teach, and the content, what to teach, and they make up the training program. As far as the process goes, this has to do with all the motor skills learning principles, and there's a whole chapter 7 in the manual that summarizes these in terms that are easy to understand. And this video demonstrates a few of them. Cher is practicing the middle section of getting up a curb, which is to say popping the wheelie, popping the casters up high enough to get on the curb. In doing so, we've segmented the skill into just doing one portion of it at a time. So that's one motor skill principle. She's using the mirror as feedback, augmented feedback of how high she's getting there. And of course, the repetitive practice is another motor skills learning principle. As far as the content goes, this video was taken when we were visiting the spinal cord the rehabilitation center in Kathmandu, Nepal, and we're doing helping with some peer training there. And this gentleman he's a peer trainer, is very skilled, and he demonstrates just a superb technique for getting down the stairs in the wheelie position. He moves forward to the edge and then drops down just as he would from a curb, but continues in the wheelie position, repositions his hands, drop down to the next curve level and to the next. So even though we recommend coming down backwards, if someone has the skills, the techniques for coming down forwards are in the manual. You can find them there. We also have content, of course, related to people with hemiplegia. So this gentleman who has hemiplegia and an amputation demonstrates using foot propulsion to try and get up an incline in the forward direction, experiences great difficulties, as is typical, and has figured out on his own to turn around and to use his foot to push backwards, and is successful at getting up the incline. Anytime high rolling resistance is encountered, the incline being just one example of that, then the backward direction is usually works a little better. So what's the evidence related to the training program? Well, if you go back to that publications and impact page and you drop down from the one we did before to the one down below here, this will do an automatic search about the wheelchair skills training program. And as of yesterday, there were 64 papers that were listed there. 16 of them are randomized controlled trials, and 2 of them are systematic reviews and meta-analyses, of which I'll show you one as an example in just a minute. The evidence pyramid in terms of how supportive a paper is about the intervention of wheelchair skills training ranges from case series, case control studies, cohort studies, but the randomized controlled trials, as I mentioned, of which there are 16 so far, are used to be considered the peak, but now the systematic reviews are available. They are considered superior because they combine the data from several control trials. So you're not overly influenced by just one. So this is one of the two systematic reviews that have been published. The other one was by Tu et al. This one we published in 2018. Laura Keeler was the lead author on it. And I'll just show part of the results there. This thing on the right is called a force plot. The 13 randomized controlled trials that were available at that time are shown here on the left. We've divided this force plot into two groups: experienced wheelchair users and new wheelchair users. And so you can see, even though there is a significant improvement for experienced wheelchair users, the biggest improvement is with the new wheelchair users. So that's the sort of information you'll get from a meta-analysis. Now, we're just about to start a new one under the leadership of Paula Rushton at the University of Montreal and a couple of her students. And we're going to broaden the search terms a little bit here to include not just randomized controlled trials and not just capacity as the outcome measure, but also goal attainment and other topics. So stay tuned for that. In addition to the levels of evidence that I showed a moment ago, the Kirkpatrick levels are also worth taking into consideration, and they're shown here. At the lowest level of evidence is just if people are satisfied with the type of training that they receive, and that's generally been the case. Is there a positive effect? Yes, we've shown that in that previous slide. However, does it change people's behavior? We don't really have much evidence about that. And does it have an impact on their lives, either financially, cost effectiveness, or improved participation? And there are a fair number of papers that show correlations or associations between wheelchair skills capacity and participation in everyday life. I'm just going to show one example here. This is from some work that this is a secondary analysis we did and published in 2019 based on some work with over 800 wheelchair users in Kenya and the Philippines. So this is a busy slide, and I apologize for that, but we're not going to go into it in detail. On the left-hand side here, we've broken down the WHO 8 service steps into about 14 different levels here. So we looked at each individual one, and we've across the top here in terms of so we'll call these the rows, and the columns are some of the major outcomes that you might see: improved daily wheelchair use, outdoor unassisted wheelchair use, improved ADLs, absence of serious falls. And we've got a composite here of 3 or more of these outcomes. And so we'll focus on this one, the composite. There's also a composite score for the services here down at the bottom. So as you can see, what you're seeing here is the odds ratio. And if the odds ratio doesn't cross the 0 mark there, then it's considered to be a significant one. This is the 95% confidence interval shown on either side of the odds ratio. So if we go to the next slide, you'll see that the single most of all the services here, the 13 services, the single most effective one, if we go over here, the provider did training. So that's some impact there just on the impact side. So I feel that there is some evidence and growing evidence to support the impact of wheelchair skills training. And we really enjoyed a visit from a WHO representative to Halifax in 2004. We showed him what we were up to, and he paused and rubbed his chin and said, "This is a very low-tech, high-impact intervention." And we never really thought of it that way, but we really liked that terminology. It is low-tech, as you can see. You don't really need any equipment except a person who uses a wheelchair and a tester who knows what they're doing. And for training, pretty much the same sort of thing, and a few obstacles that can be found in everyday life. But in addition to being low tech, it's high impact. It makes a big difference to both people's skill level, but also increasingly we're able to see that it has an effect on their participation. So in terms of whether this information, now that we're reasonably happy with it, is getting out there, we track our wheelchair skills program metrics. and we put them on the website. So as of June of this year, and beginning when we started keeping track of it in 2007, there had been 145,000 users of our website from 196 countries. That's almost every country in the world. We've only just recently started our own YouTube channel to put make some of the videos more readily accessible. So it's really only 3 years worth of data here, but already we've had 141,000 views and almost 3,000 hours of viewing on that channel. So we're pretty encouraged by that. As far as to some evidence of the low tech side of it, we've done this sort of training. Members of our wheelchair skills program team have traveled to and done in-person training in high and low resource settings around the world, as are shown here. Within the next 6 months, there will be an additional training taking place here in the Dominican Republic, and another second visit to Uganda both by Amira Tawashi. The wheelchair skills program is in evolution, as I mentioned earlier. We've just moved up to version 5.2. We don't feel that this has been perfected in any way. If anything, we're way back down here. It's just really beginning at it. We've only been at it for 25 years, but we're really optimistic by what we've seen so far, that by the time we really get it all well developed, that it will be a really effective tool and a resource for people. So I think it's fair to say, even at this early stage in 2021, that this is the gold standard, that wheelchairs should be provided using the 8-step process of the World Health Organization. All people who use wheelchairs and their caregivers should have their wheelchair skills assessed, either by questionnaire or by looking at them. Third, wheelchair skills training should be provided if it's appropriate, if something is needed. And finally, that assessment and training should be documented in the health record. You don't need to use the wheelchair skills program, but you should be doing assessments, and you should be doing training, and you should be documenting it. However, although that is the gold standard, I would say for this year, excuse me, we have just completed a couple of online surveys. The first was done in Nova Scotia, and this has just been recently published in the Disability and Rehabilitation System Technology. And we found that even in our own center, less than half of the therapists answered yes to the question, do you typically provide wheelchair skills training when providing a wheelchair? Rather disappointing. So we've just completed, and this has just been accepted in September 30th of this year, and it's just available electronically published in the same journal. This is a global online survey, and we were pleased to get 309 responses from 35 different countries. And the answer to the question, do you typically provide wheelchair skills training, was 81% for clients, and slightly less for, or about the same for caregivers if you count both yes always and yes usually. And they all really felt it, or most felt it was a very important thing to do. Most felt reasonably prepared to do that training. However, when you looked at the duration of training, it was only 45 minutes for clients and for 30 minutes for caregivers, and the median number of sessions was 2, which is really an inadequate amount of training, in my opinion. I think what we're seeing here is an example of what happens so often, that knowledge translation really takes a long time. From the basic biomedical research and the clinical research, there are a couple of places where things don't end up in clinical practice, and I would argue that we're currently in this is valley number 2 of the 2 death valleys of the clinical translational continuum. So we still have a lot of work to do, not only to further document and improve on our assessment and training procedures, but also to get them into practice. So to return to our session objectives, to wind up before we take some questions, the benefits and problems of wheelchair use, we talked about briefly, that it's really the wheelchair is the most important piece of assistive technology, and assistive technology is the most important thing we do in rehabilitation. The 8 steps of the wheelchair service delivery process include assessment and training of wheelchair skills, among other things. There is a free online resource, the Wheelchair Skills Program. There are other resources, such as the Wheelchair Maintenance Program developed by the University of Pittsburgh. There's transfer training. There's a variety of free online resources, of which ours is only one. The extent of supporting research evidence, it's easy to look that up on our website, but there's quite a bit and it's growing continuously. And as far as how to implement these protocols in your own settings, just start. Just the next time you see somebody who's getting a wheelchair, just ask them what they can do, ask them to demonstrate what they can do. If you see something that you think they can improve upon, help them learn how to do it. It's just that simple. This is a painting done by an artist who lives across from our cottage. This is down in Nova Scotia near Peggy's Cove. Some of you may have visited it. It's entitled Fresh Paint, and it's a fishing boat that's been freshened up with new white paint, new blue paint. And I guess I like the metaphor of this for what it is we're hoping that this lecture, this webinar will do, which is to take something that you're currently doing, wheelchair service provision, and by doing a little better job with wheelchair skills assessment and training, that we put a fresh coat of paint on, and you'll be a little happier with it. So that's the end of the presentation, and I will stop sharing and be happy to take your questions.
Thank you so much for the excellent presentation, Lee. It's amazing to see all the great work you and your team has done. I'm personally impressed with the website stats. Traffic from all the countries in the world is very, very impressive. So congrats to you. It's truly an honor for us to have you kick off our webinar series. And on behalf of our ISWP team, our sincere thanks to you for your time. So on that note, I would like to open the floor for questions from our participants today. Any questions for Dr. Lee? Kirby?
Okay, I see a question there about a training that's available to learn how to do these things. One of the links on our website is upcoming courses, and we typically put on an annual in-person workshop, a full day session. It's not enough, of course, but it's about all the time people can usually take. And we've had to cancel that this year and last year due to COVID, the restrictions about the number of people we can get in a room. But last year and this year, we've converted the same material to an online remote learning opportunity. And we're today, in a few hours, it'll be the third week. What we do is we provide self-study materials each week, which consist of certain pages to read in the manual and certain videos to look at on the YouTube channel. And then we meet once a week by Zoom for an hour to discuss those or to demonstrate anything people would like to see demonstrated. We also are open to traveling anywhere once COVID gets over to put on workshops in different places. The training that takes place as part of the WHO basic training package is relatively small. And the ISWP is working through its hybrid committee to change that, to try and build on the amount of training that's being presented. And we've been advocating to the World Health Organization to increase the proportion of training that makes up their training packages. And hopefully we'll succeed.
Thank you so much. Just wanted to
Any other questions? And people can feel free if if something doesn't come to you in the next few minutes. If you do have any reason to want to get a hold of me, it's my email address is kirby@dal.ca, or you can just write to the Wheelchair Skills Program, WSP@dal.ca, and I would be happy to answer any of your questions in that way.
Thank you again. So with that note, if there are no further questions, I think we'll close this webinar for today. Thank you again for your wonderful presentation and for your time, and keep up the great work that you're doing. Thank you.
Well, thank you for the opportunity, and thank you for those of you who tuned in to listen. I really appreciate your attention.
Thank you.